Welcome to the deep dive. In a world just, drowning in data, large language models have become this critical shortcut.
They really have.
They're now the main tool for quickly getting a handle on complex scientific research, which is essential for, well, everyone from researchers to policymakers.
And that shortcut, that distillation process, is exactly what we're diving into today.
Right.
Because our sources are pointing to a really systemic issue here. It's something that threatens the integrity of how we communicate science using AI. They're calling it generalization bias.
Generalization bias. So LLMs are powerful, but they're summarizing things too broadly?
That's it exactly. Systematically, they summarize conclusions more broadly than the original science actually warrants.
And we're not just talking about, a few word choices here and there.
Oh, no.
This whole deep dive is based on a massive study, a systematic one that tested this bias across 10 of the big LLMs. We're talking ChatGPT 4.0, DeepSeek, Llama 3.3.
Yep, and they ran 4,900 AI-generated summaries against the original peer-reviewed texts.
So our mission today is pretty clear then. We need to unpack how often and I guess why these algorithms are doing this, why they're generalizing these cautious scientific findings.
And most importantly, what tactical changes you, the listener, need to make if you're relying on these tools for accurate information.
Okay, let's get into it.
So, to start, we should probably understand the framework the researchers set up.
How they measured this.
Exactly. They define conclusions in two ways.
Hmm.
Either restricted, which means the summary was faithful to the original text's limits,
Okay.
or generalized, meaning the LLM broadened the scope in one of three very problematic ways.
And what's the first one?
The first type they flagged was something called generic generalizations.
Okay.
This is where the AI strips away all the specific conditions or, the quantified percentages from the study.
So it takes out the context.
It takes out the context. Say, a finding that only applied to a small group of participants gets turned into this unquantified present tense statement that sounds like it applies to a whole category.
Right. So if the original text says, in this trial, 75% of participants who did X saw Y, the LLM just simplifies it.
Precisely. It might turn that cautious, quantified statement into something declarative, like parental warmth is protective.
That sounds like a universal truth.
It does, and it completely obscures all the necessary nuance about differences between individuals that was probably in the original study.
It's chasing fluency, not accuracy, which I guess brings us to the second type you mentioned, this shift from past tense to present tense. What's the big deal there?
Well, when a research claim is made in the past tense, it's inherently limited. It's only referring to the specific sample they tested at that one time. Consumption of coffee did not result in whatever outcome.
It's contained.
It's contained. But when the LLM changes that to the present tense, consumption of coffee does not increase. It suddenly extends that finding way beyond the original sample. It implies it's an established, current scientific fact.
That is a very subtle change in language.
It is.
But it has a huge effect on the scope. It makes a single limited finding sound like it's true for everyone everywhere right now.
Exactly. And the third type is maybe the most dangerous one, especially when you're talking about policy or medicine.
Okay.
It's jumping from a descriptive to an action-guiding statement.
So from what was found to what you should do.
You got it. The original text might just describe a result, something like, these findings support the use of X in secondary prevention.
Yeah.
But the LLM summary transforms that into a really confident recommendation. It'll say, X should be recommended for Y patients.
But the original authors might have deliberately avoided saying that, maybe because there wasn't enough long-term evidence.
Absolutely. But the LLM, in its, quest to be helpful, basically just writes the clinical guideline itself.
Wow.
Yeah.
So using those three metrics, the generic, the tense shift, and the action guiding, what was the overall score? What did they find across all the models?
Well, the top-line finding is definitive. When you combine all the LLM summaries, they were twice as likely to contain a generalized conclusion compared to the original abstracts.
Twice as likely. So it's not a fluke. It's systemic.
It's systemic. It's a clear algorithmic tendency.
And twice as likely is alarming enough, but I have a feeling that average is hiding some even bigger numbers.
It is. We have to dive into the individual models because the variation is pretty significant.
Which ones were the worst offenders?
So 6 out of the 10 models showed a really significant tendency to overgeneralize. That includes big names like GPT-4 Turbo, DeepSeek, and both Llama 2 and 3.3.
Okay.
But the extremes were just shocking. Llama 3.370B and ChatGPT 4.0 were some of the worst. Llama 3.370B was shown to be up to, get this, 39 times more likely to contain a generalized conclusion than the original abstract.
Right, wait, 39 times?
39.
That's not a communication error. That feels like the model is actively choosing to overwrite the scientific caution.
It really does. And this leads to something that is highly counterintuitive.
What's
The data shows that the near, bigger, supposedly more powerful models, they actually had a stronger tendency to overgeneralize than some of the older ones, like GPT 3.5 Turbo.
So the models are getting better, but they're getting worse at this specific thing.
It seems so.
Does the study have a theory on why? Is it something in the training data, or is it a side effect of trying to make them safer or more helpful?
The hypothesis really leans toward that latter point.
Ah.
It suggests that during all that fine-tuning, the models are implicitly rewarded for giving answers that are confident, fluent, and really broadly applicable.
Answers that feel more helpful to a user.
Right, even if that means just tossing out the restrictive, careful language that scientific rigor demands, there's a trade-off happening.
But there was a major exception, right? One group of models that didn't follow this trend.
Yes, the exception. The Claude models, Claude 2, 3.5 Sonnet, and 3.7 Sonnet, they didn't significantly differ in their generalization accuracy from the original text.
So they were basically on par with the source.
Consistently. They were the most faithful to the original scope, and that held true for both their newer and older versions.
Interesting.
So to make this a bit more real, let's look at a couple of specific examples from the source material. We can focus on that most common error, turning a quantified claim into a generic one.
Okay, let's do it.
All right, take some findings on bariatric surgery. The original text was very careful. It said, among adults with obesity, bariatric surgery was associated with a significantly lower incidence, and so on.
Right, among adults with obesity. That's the key restriction.
It's the whole context. But the summary from DeepSeek just overgeneralized it to state. The study concluded that bariatric surgery is associated with a significantly lower incidence.
It just took out the restriction.
Completely gone. Which makes the statement sound like it applies to anyone, regardless of their health profile. In medicine, that distinction is everything. It turns a specific finding into a really misleading blanket claim.
And I imagine this gets even riskier with something like pharmaceuticals.
It does. Let's consider a drug example. Dolaglutide. The original abstract was super specific. It said the drug was superior to a placebo, but only at a specific dose for a specific duration, just 26 weeks, and with certain co-treatments.
A lot of conditions.
A lot of boundary conditions. But the LLM summary just gave this broad, generic claim that the drug is an effective and safe treatment option for youths with type 2 diabetes.
Which erases all those safety parameters that could guide a user toward an intervention that hasn't actually been proven safe outside those very narrow conditions.
Exactly. It's a huge potential risk.
So what does this all mean for you, the person listening and using these tools? Can we fix it? Can you just write a better prompt?
A great question. And they tested that. They tried 3 different prompts.
Yeah.
A simple one, a systematic one, asking it to work step by step, and an accuracy prompt.
And the accuracy prompt said what? Be accurate.
Pretty much. Do not introduce any inaccuracies when summarizing.
The gun that they found was a total contradiction, wasn't it?
It was. They actually called it the prompting paradox. Because explicitly using that accuracy prompt, it backfired. Summaries generated with that prompt were about twice as likely to contain generalized conclusions compared to the simple prompt.
Hold on. Asking the model to be accurate made it less accurate.
Yeah.
That feels like a glitch in the matrix.
It really does. The leading hypothesis is that by telling the model to avoid inaccuracy, it triggers something like an algorithmic version of the ironic rebound effect in psychology.
You mean like, don't think of a white bear?
Exactly like that. It forces the model to focus on the negative constraint, which makes the error it's trying to avoid more likely to happen.
Unbelievable. But there was one thing that worked, right? One technical fix.
There was one highly effective mitigation. The LLM temperature setting.
Which controls the randomness of the output.
Right. And summaries generated at the most conservative setting, temperature 0, were 76% less likely to contain generalized conclusions compared to a more creative setting like 0.7.
So for high-stakes work, turn the creativity down to 0.
That's the takeaway. If you're using an API, conservative settings win.
Okay, so that's a critical tip. Now, we've established that LLMs generalize more than the original text. But humans simplify things too when they're communicating science. How do the LLMs compare to actual human experts?
That direct comparison might be the most important finding in this whole deep dive.
Right.
The researchers compared LLM summaries of medical articles to summaries written by expert human authors for the New England Journal of Medicine Journal Watch.
So a real head-to-head.
A real head-to-head. And the result was striking. The LLM summaries were almost 5 times more likely to contain generalized conclusions than the summaries from the human experts.
5 times.
To be specific, the odds of an LLM generalizing were nearly 5 times higher than the odds of an expert human communicator generalizing.
So the bias isn't unique to the algorithm, but the algorithm is just amplifying it massively.
Exactly. The LLMs have a generalization bias that is significantly more pronounced than what we see even in expert humans.
So after all that, what should you take away from this entire deep dive? What's the final word?
I think the main point is that the convenience of LLMs for scientific summaries, it comes with this really potent, persistent, algorithmic bias toward overgeneralization.
What's not hopeless?
It's not. You can mitigate it. First, if you're using an API for anything high stakes, use a conservative temperature setting of 0.
Right.
Second, don't use prompts that explicitly ask for accuracy or to avoid inaccuracies because of that weird backfire effect.
And third?
And third, if the precision of the scientific scope is really your #1 concern, the Claude models consistently perform closest to the original texts.
This research just highlights such a fascinating tension. LLMs are so clearly being optimized for helpfulness, giving these fluent, confident, broadly applicable answers.
Yes.
But that very optimization is what's actively undermining scientific caution and precision. What does that mean for how we share knowledge if the AI is engineered to favor confident fluency over restrictive, quantified accuracy?
It's a huge question.
It really raises a fundamental question about the future of information. What kind of knowledge are we choosing to prioritize when we instinctively just reach for the fastest, most definitive answer? Something to chew on the next time your chatbot summarizes a complex study for you.